If you have just been told you have triple-negative breast cancer, the days right after can feel strange and heavy. You might be moving through appointments while feeling numb. You might be crying at things that never used to bother you. If that is where you are right now, this video is for you.
This is the Nurse Angela channel. Angela is a registered nurse, and she has been through those early weeks after a TNBC diagnosis herself. What follows is education, not medical advice, and it cannot replace your own care team.
First, the thing you most need to hear. You are not weak, and you are not imagining this. In one study that followed women with early breast cancer, about 1 in 3 had depression or anxiety around the time of diagnosis. About 1 in 4 still did 3 months later. By 1 year, it was closer to 1 in 7. Feeling this way early on is the rule, not the exception. And here is something you deserve to hear straight. Nobody has published a reliable number for how often depression happens, specifically with triple-negative breast cancer. Every figure we have is for breast cancer overall. If someone quotes you an exact TNBC percentage, they are guessing. There are real reasons the early TNBC window can hit especially hard. Treatment often starts quickly, so there is little time to catch your breath. Triple-negative does not respond to hormone therapy or to HER2 drugs, so there is no daily pill afterwards that feels like a shield. It is diagnosed more often in younger women, and the risk of it returning is highest in the first few years. Every one of those 4 things is documented. What researchers have not shown is that they cause more depression in triple-negative than in other breast cancers. So hold them as reasons. Your feelings make complete sense, not as a prediction about how you will do. So how do you tell ordinary grief from depression that needs treatment? Grief tends to come in waves. It knocks you down, then it eases, and in between, you can still laugh at something or feel close to someone. Depression is flatter and more constant. The clearest signal is time. Feeling low or losing interest in nearly everything most of the day, most days, for longer than 2 weeks. Now, the genuinely tricky part. Chemotherapy causes exhaustion, poor appetite, and broken sleep all on its own. Those overlap almost exactly with depression, which makes them unreliable clues. Cancer specialists say to look at the feelings in your head instead. These are the signals that matter most. Hopelessness. Guilt with thoughts like, I brought this on myself, or I am letting my family down. Feeling worthless. Losing pleasure in the things you have always loved, and any thoughts of not wanting to be here. Those 5 are not chemotherapy side effects, and they are worth telling someone about today. This is treatable, and we know what works best. Talk therapy is the first choice. 2 kinds have the strongest evidence behind them: cognitive behavioral therapy and behavioral activation. Among people who already had depression symptoms, the average person who got therapy did better than about 82% of those who got nothing. And it works 1-to-1, in groups, by video, by phone, even through an app. Movement helps too. Around 150 minutes a week of moderate activity has been shown to lower depression in breast cancer survivors. Mindfulness and meditation help in the short and medium term. To be straight with you, the exercise research is positive but mixed, and it looks stronger for depression than for anxiety. It is still low risk and worth trying. Just clear the plan with your team first. What about antidepressants? This one surprises people. The most recent expert guidance does not recommend medication as the first step for mild to moderate depression, because the research behind it turned out to be weaker than most of us assumed. That does not mean it never helps. It helps some people a great deal, particularly with severe depression, or if it worked well for you before.
It means the decision belongs to a prescriber who knows your case. And because some antidepressants can interact with cancer treatment, tell your team about every medicine and supplement you take and never start or stop one on your own.
Now, how to actually get help, because this is where people get stuck. More than 9 in 10 patients want to discuss their feelings with their doctor, but many quietly wait to be asked first. Please do not wait. Cancer centers rate distress on a scale from 0 to 10, and you can use that scale yourself. Try saying, "My distress is a 7 out of 10, and I would like to talk to someone." At most centers, a 4 or higher already triggers a referral. You can also ask straight out for the social worker or for psycho-oncology. One more thing, and it matters. Suicide risk is higher during the first year after any cancer diagnosis, and highest between 3 and 5 months in. That is a documented pattern across cancer types. If you are having thoughts of ending your life, that is a symptom that needs care, not a character flaw. In the United States, you can call or text 988 at any hour. It is free and confidential. Press 2 for Spanish. If someone is in immediate danger, call 911.
And finally, free help that genuinely exists. The Triple Negative Breast Cancer Foundation runs a helpline staffed by oncology social workers who know this exact diagnosis. Cancer Care offers free counseling and support groups. The American Cancer Society answers around the clock, and the cancer support community has a free helpline in more than 200 languages. Every one of these costs nothing. If you take one thing from this, let it be this. The heaviness of these first weeks is common. It is not a sign that you are handling this badly, and it responds to treatment. 2 weeks of feeling flat is your signal to speak up. You do not have to figure this out alone.